In the relentless quest to understand, treat, and ultimately conquer cancer, artificial intelligence has emerged as one of humanity's most powerful allies. The collaboration between brilliant scientific minds and cutting-edge technology is transforming the landscape of cancer research and care. As Google's Director of Applied AI, Scott Penberthy has witnessed firsthand the profound impact AI is having on the fight against cancer, a battle fought not only in laboratories and hospitals, but also within the realms of data and computation. Cancer remains one of the most formidable health challenges of our time. Every year, millions of people receive the devastating diagnosis, facing a journey fraught with uncertainty, fear, and hope. What makes cancer particularly challenging is its very nature. It is not a single disease, but rather a complex family of diseases. Each cancer is unique, even down to the molecular level within an individual's body. For decades, scientists have sought tools that could parse through this complexity, revealing hidden patterns and promising new pathways for treatment. This is where artificial intelligence is proving to be a game changer. Scott Penberthy describes the promise of AI in cancer as a revolution driven by data. Over the past decade, the sheer volume of medical data has exploded. Genetic information, medical imaging, electronic health records, clinical studies, and more. Processing and making sense of this tidal wave of information is an overwhelming challenge for even the most seasoned experts. But AI thrives on data. Machine learning algorithms can comb through millions of data points, uncovering subtle patterns invisible to the human eye. Machine learning, a core branch of AI, is particularly well-suited for interpreting medical images such as X-rays, CT scans, MRIs, and digital pathology slides. Early detection is crucial for improving cancer outcomes, and AI tools are now being developed and deployed to identify early signs of cancers far earlier and with greater accuracy than ever before. In some groundbreaking studies, AI systems have matched or even surpassed human radiologists in detecting tiny tumors that might otherwise go unnoticed. For patients, this could mean a better chance of survival, as earlier interventions are often more effective and less invasive. But beyond imaging, AI is making strides in genomics, the study of our genetic code. Cancer is, at its core, a disease of the genome. Mutations drive cells to grow, divide, and eventually invade surrounding tissues. Modern sequencing technologies can read the entire genetic makeup of a tumor in hours, producing massive files of data. Interpreting these files to distinguish between harmless genetic variation and dangerous mutations is an enormous task. Here, too, AI algorithms step in, trained on countless examples to spot genes or gene combinations that signal different types of cancer, predict how aggressive they might be, and even suggest personalized treatment options. Scott Penberthy emphasizes the power of precision medicine, powered by AI. No longer is cancer treatment a one-size-fits-all proposition. With AI, doctors can analyze mountains of data, genetic, clinical, environmental, about individual patients to recommend therapies more likely to succeed. Imagine a world where the standard of care for every cancer patient is based not simply on broad categories, but precisely tailored to their unique disease. This vision is becoming reality, as AI identifies biomarkers that predict a patient's likelihood of responding to certain drugs, or flags risks of serious side effects before they arise. The work doesn't stop at diagnosis and treatment choice. AI is also reshaping the way cancer drugs are developed and tested. Traditionally, creating a new cancer drug can take over a decade, with enormous financial and human costs. AI now accelerates this process by rapidly screening vast chemical libraries for promising compounds, modeling how new drugs might interact with cancer cells, and identifying which patients stand to benefit most from experimental therapies. Clinical trials, the backbone of medical progress, are being optimized by AI as well, enabling doctors to match eligible patients with new studies more quickly and efficiently. A crucial arena where Scott Penberthy sees AI making a transformational impact is in global accessibility. Quality cancer care has often been concentrated in major hospitals and research centers, leaving many populations underserved. AI, deployed through cloud-based platforms and digital health tools, holds the promise of democratizing expertise. A rural doctor with access to AI-powered diagnostic platforms can provide world-class cancer screening, connecting patients to advanced care no matter where they live. Languages, borders, and geographical barriers are becoming less restrictive as intelligent systems interpret data, images, and genetic codes, sending signals of hope to even the remotest corners of the world. This technological progress is accompanied by important conversations about trust, transparency, and privacy. Scott Penberthy and his colleagues at Google recognize that AI must be developed and deployed with the utmost responsibility. Medical data is deeply personal, and protecting patient privacy is paramount. Ethical frameworks guide how AI is trained, validated, and applied, ensuring that human oversight remains central to all clinical decisions. The vision is one of partnership, where doctors, nurses, patients, and artificial intelligence collaborate to deliver the best possible outcomes. As remarkable as AI's progress in the war on cancer has been, Scott is quick to remind us that this is only the beginning. Every breakthrough leads to fresh questions and fresh challenges. Even the most sophisticated algorithms require high-quality data, robust validation, and continual oversight. Moreover, AI is not a substitute for the compassion and intuition that define the best of medical care. Instead, it is a tool that empowers healthcare professionals, freeing them from tedious tasks, providing timely insights, and allowing them to focus on what matters most, caring for the patient. The road ahead will not be easy. Cancer remains a changing, adapting adversary. Yet with each passing year, the partnership between human ingenuity and machine intelligence grows stronger. New algorithms are trained. New discoveries are made. The gap between data and actionable knowledge steadily closes. For patients and families affected by cancer, these advances offer something priceless. Hope. Hope for earlier detection. Hope for more effective treatments. Hope, ultimately, for cures. Reflecting on the journey so far, Scott Penberthy sees not just a revolution in technology, but a renaissance in human potential. The synergy of AI and medicine is revealing the hidden architecture of life itself, enabling us to rewrite stories once thought unchangeable. In the fight against cancer, AI is not just a tool. It is a catalyst for a future where every life touched by this disease can be met with swift, smart, and compassionate care. The war is far from over, but the tide is turning. Partners like Scott Penberthy and the teams at the frontiers of AI research continue to drive this transformation, unwavering in their conviction that, together, humans and machines can outsmart cancer. With imagination, diligence, and resolve, the next era of medicine is at hand, one where cancer may one day be not a sentence, but a solved riddle.